Welcome and thank you for joining us for this Facebook live stream media conference. Today's presenters are Mark Henry, Clinton County Legislature Chairman, Dr. Wouter Rietsema, CVPH Vice President for Population Health and Information Services and an infectious disease physician, and Erin Streiff, Clinton County Health Department Director of Healthcare Services. Each will provide a brief update and then we will do our best to answer your questions. Mr. John Canosa and Mr. Eric Day, John Canosa, Clinton County Health Department Director of Public Health, and Eric Day, Director of Clinton County Office of Emergency Services, are also on hand to assist with responding to questions. Since we anticipate duplicate questions on the same topic, please listen carefully, as the information you are seeking may be answered in the prepared remarks or along with other questions that are being asked. At this point, I would like to invite Mr. Henry to the podium.
Good morning, and thank you everyone for inviting me here today. I am Mark Henry, and I am the chair of the Clinton County Legislature. But today, I come to you in one of my other roles. That is a member of the Regional Control Room. Our region consists of 7 counties: Jefferson, Hamilton, Lewis, St. Lawrence, Franklin, Essex, and Clinton. These regional control rooms were established by the governor to monitor the hospitalization rate, the death rate, the number of new hospitalization, hospital bed capacity, ICU bed capacity, testing, and contact tracing within these 7 counties, which comprise our region during these phased-in reopenings. If the region's metrics no longer meet the reopening guidelines, we can adjust the reopening plan for that region accordingly. We hold virtual meetings every day to discuss common problems that may be occurring across the region and may affect our health metrics or might prevent businesses from opening as scheduled. I imagine by now most of you, if not all of you, are aware that our businesses are scheduled to reopen in phases. We are currently well into phase 1, which includes construction, agriculture, forestry, and curbside retail. The Regional Control Room has been closely monitoring the metrics of our region to ensure that these new business activities have not caused any increase in COVID-19 related incidents. Thus far, we have done very well as a region, and we are now poised to begin phase 2 reopening very soon, should everything continue as it is. In addition to being a member of the Regional Control Room, I also chair a Clinton County working group that meets once a week to discuss those issues that may be unique to Clinton County. The working group consists of local elected leaders, health experts, business, and educational leaders. While we are primarily interested in those issues important to Clinton County, we very much have a regional outlook. We are dependent upon our neighboring counties and businesses. We recognize the importance of our Canadian friends, and if we are truly to succeed, we need to ensure that their voice is heard as well. Our schools, community college, and SUNY Plattsburgh also play an important role in any future success. We need to have reopening health policies and guidelines that take all of this into consideration. We are hopeful that we will soon receive word that we can begin reopening those phase 2 businesses: professionals, administrative support, salons and barber shops, and retail. We are hopeful that phase 2 goes as well as phase 1 has been, and we can look forward in a couple of weeks to moving into phase 3 and opening bars and restaurants. The reason we were able to reopen in phase 1 and are now looking at phase 2 operations is because of you. You listened to the advice given to you by the health professionals and acted responsibly. We were able to keep our numbers low, and we were able to reopen some businesses in phase 1. Now, because you have continued to act wisely, we are prepared to transition into phase 2 and then reopening phase 2 businesses we discussed earlier. I ask that you please continue to do those things that got us this far. Wear a mask, keep social distance, wash your hands, and continue to be smart and safe. Please do not get complacent. I know the weather is getting better and our numbers are low. I know that graduations have been canceled. Many other activities have been postponed or canceled as well. The temptations to push the envelope of safety are always there. Some may even be thinking that we are almost at the end of this. I certainly hope that we are. But no one can really tell you when this will end. We don't really know how far we still have to go. We know we have a plan to phase in our businesses, but it is very apparent that this virus does not follow plans. I ask you to continue to be safe for many reasons. The overwhelming reason is for your health and the health of those around you. There is nothing more important than that. This has been our focus since day one. But I also ask on behalf of those businesses that are yet to open and are still waiting for phase 2, 3, and 4 to catch up with them. I ask for those employees who want to go safely back to work. They deserve a chance too, and we can give it to them by continuing to do those things that brought us this far. It would be disastrous if we had to go back to square one and restart. I know none of us want that. I want to take this opportunity to thank you for all you have done to protect your health and that of the community. Thank you for helping to keep our numbers low. Thank you for your patience and understanding as we all go through this difficult time and process together. You are the reason we have come as far as we have, and you will be the reason that we will see the end of this. Thank you.
Good morning. My name is Wouter Rietsema. I'm a Vice President at CVPH. Just an update on where CVPH is. We are, I think the thing I want to say is that broadly we are open. We are opening certain services up which have been constrained, and we are safe. So that's sort of a theme through everything I'm going to say. In the offices, we are gradually increasing our volume of patients that we can see in the offices. It is a challenge. We have all new, the concept of a waiting room does not exist anymore. We are not using waiting rooms, or if we have very large waiting rooms, we would minimize the people sitting in them. And these workflows are different office to office depending on their location and their patient volume. So as we work through these workflows, not everything is always smooth, and we just ask everybody to bear with us through that. Right now, we are trying to work through some backlogged appointments that we need to get to, but shortly as we work through that, we will be opening up our appointments in various offices and locations. On the surgical side, we have started doing elective procedures. This too is a challenge. Any of you that have had a procedure or are planned for one know that now you have to get tested for COVID prior to the procedure. Not for every procedure, but for the vast majority of them, except for very minor ones. It's not really optional. For emergency surgery, obviously, that may not occur. But for any elective type procedure or scheduled procedure, you must be tested according to New York State guidelines. And we have to test within a very narrow period of time, 3 days. So it can be a challenge to get that testing done and to get the result back in time for your surgery. And so we're trying to work with our patients and our staff to get those workflows down. We will also be starting to schedule procedures that are not just outpatient procedures, but that might require an inpatient stay as well. Um, on the lab and diagnostic front, we will be on Monday, we will be opening our location up by the Hannaford's shopping area to laboratory and radiologic testing. It's important to note, though, that we're not opening it up as just a walk-in. That in fact all of that testing will be done by appointment. Obviously, that's going to be a challenge. It's going to be difficult for people, so we will publicize more in a press release on that later this week. We will be publicizing it to our doctor's offices as well. So again, bear with us. We're all learning as we go. Lastly, from a standpoint of COVID in the hospital, we have not seen any increase in hospitalization. As of yesterday, I'm not aware this morning, as of yesterday, we still had one patient in the hospital, but we haven't seen an increase, which is good for our community. So with that, I will leave my prepared remarks. Thank you. Erin?
Hello, my name is Erin Streiff. I'm the Director of Healthcare Services for the Clinton County Health Department. I will start with our numbers, as I usually do. We are at 180 total cases. We are at 168 recovered, 4 died, and 8 who are currently ill. I do want to take a moment to just talk about the term recovered, because that's a question that's come up. When we say recovered from a public health definition, that means that they're able to come off of isolation because we don't consider them to be infectious. It does not, unfortunately, necessarily mean that they are totally feeling the same physically as they were before the illness, but we are using the CDC definition based on symptoms of allowing them to come off of their isolation orders, and that's how we define recovered. I'm going to also go in just a little bit to the reopening that Mr. Henry discussed, and I want to specifically use the words that I've seen on the state website: caution, reason, and patience. And I will say I'm the worst at patience. Most people who know me will acknowledge that as well. I'm not a patient person. I want everything to happen immediately and happen well and be perfect, but that's not real life. And so we have to continue to maintain patience, all of us, as we go through this. I also just want to acknowledge the work that all of my colleagues have done, but a special thanks to our contact tracing team, and that includes public health staff as well as the sheriff's deputies, because they, above all else, are adhering to the mission, our collective mission as a county, as a region, as a state, and that is to protect the health of the public. And it's not always easy and it's not always popular, and they are staying true to that mission, and I really appreciate it. So thank you to all of you who do that and also support that work. Just a few things, I will be brief today, as we are talking about going outside, because it's just beautiful out right now. This week is really welcome. We need to continue to wear our cloth face coverings, and this is what most of us are willing to do to keep protecting each other. It's going to become less comfortable as it gets hotter, but we have to keep doing it, and that's not just to prevent ourselves from getting the virus, but it's if we're sick so that we're not spreading it, and that's what we have to remember, is that we're protecting each other by doing this. Keep washing your hands, keep maintaining the physical distancing, covering your coughs and sneezes, cleaning and disinfecting, everything we've been talking about, keep it up. Now is not the time to stop. And then as we do go outside, we want to still maintain small groups, preferably with immediate household members. We don't want to be mingling with a lot of other people. We saw that a couple weeks ago with some parties that were happening with some college-age students, unfortunately. So the risk is not gone. The risk remains, and we have to continue to be vigilant. We would also recommend that you avoid playground equipment, especially if the playground is marked closed. Do not go on it. And don't share equipment such as bicycles, helmets, balls, frisbees, because even though masking is the single most, at this point, recommended practice to prevent the spread of the virus, studies have been showing this, that there's still a possibility of being able to contract the virus from a surface, so it's prudent to avoid sharing objects, especially among people who might not be in your immediate household. And if an individual is at higher risk, and that includes individuals with medical conditions or older adults, they should avoid visiting outdoor spaces or being in settings around a lot of other people at this time, and they can continue to remain in their backyard or other outdoor spaces that don't involve crowds. That's all I have for today. Any questions?
I will start with the questions. I do not know that the first one will be for you, but I'll start with what I've got. The first question we received is, do phase 2 salons include nail salons?
Do you feel...
Can you give me the question again, please?
Do phase 2 salons include nail salons?
I've got I don't know.
As a follow-up to that, there was a second question that says, is the DMV opening in phase 2? Do we know how that will look?
Again, I do know the answer to that, but we're waiting for the governor to announce that. That will be outside. We think that it may be in June sometime. I can't give you a date, because if I do, I know people are going to be lined up in front of that door. But we think that DMV will be open in some respect, maybe in June.
Is it up to salons / barber shops to make their shops socially distant, or is there a state plan they are following?
Well, the guidelines are out, and they're basically the same for all the businesses. Obviously, salons have different challenges. I would let anybody from the health department answer that, but there's going to be guidelines there for the hair salons. Maybe somebody knows the exact guidelines.
Hello, Clinton County, John Canosa, Director of Public Health. On the salon issue, there will be state guidance on that. Definitely, you're always searching state guidance, state regulations for that. The governor's orders are updated and or revised almost weekly, but I definitely can push you in a direction to contact the North Country Chamber of Commerce. There's an upcoming webinar being provided. I believe it is Friday the 29th. Gary Douglas at the North Country Chamber of Commerce and all of his staff have done a really good job putting out sector-specific seminars for the business world. So you'll definitely want to pay attention to that. He will have the most updated information available for you.
Another question regarding opening, is the mall part of phase 2?
I'm not doing very well with answers today. Retail shops, right now, retail shops are open for curbside service. You can call ahead and you can get takeout from the retail. Retail businesses in phase 2 will now be able to have patrons actually enter their business. Of course, you still have to follow all the guidelines and all the rules. I can't speak for every business in the mall because there's so many different businesses there. Guidelines will be coming out from the state as to that. So I would imagine that the mall is going to be treated like the individual retail businesses, but then you have all the common space in there. So there may be some specific guidance that's coming to malls.
Thank you very much. The next question has to do with visitor policies at the hospital. There's a couple of different questions. The first question was, do you know when one visitor will be allowed to accompany patients for services like OBGYN visits or the Fitzpatrick Cancer Center?
Do not know when. Our visitor policy is really patterned directly from the New York State visitation guidelines. I don't have a clear answer to that. They are little by little trying to loosen certain parts of it, and I am not fully conversant with all the details, but the policy hasn't changed much since during the height of COVID, and I don't know exactly when it will relax. I think we need to remember what is our goal here, and our goal is to keep our healthcare workers and our patients safe. And the most effective way is to keep people distanced. If you can't do that, then masks. If you start bringing more people into a space, then the first method gets less effective. So I think that we will take that into consideration, and the governor's guidance will affect that as well.
Thank you. The second part of that question is, what is the visitor policy for the labor and delivery or maternity floor?
So I don't know the details. It remains fairly strict, limited to, I believe, one family member and perhaps a labor coach. But I would encourage, if you are expecting, which and I would assume this has already happened, that folks who are expecting would speak with their OBGYN providers who can give them the details. That one is very specifically regulated by the state. There have been some data, especially in the city, about pregnant women and COVID, which has caused them to be very, very careful. Additionally, although we talk about children as being less affected by COVID, that is not necessarily true about infants. So I am not aware that that has loosened much. It's still quite restrictive.
Okay, thank you very much. We have received a couple of questions about yard sales. So a couple of the questions we have received about yard sales are, what are some of the risks associated with having a yard sale during the pandemic, and could yard sales potentially hurt our chances of reopening further?
The risk associated with yard sales, garage sales represent gatherings of people. Ordinarily, pre-COVID, not a big deal. You want to make sure that you don't want a lot of people coming onto your property at one time. They're rushing you, trying to all make deals. In this case, with COVID, you're going to have the additional risk of a lot of people intermixing with close distance. We're trying to keep that social distancing and 6-foot separation between people. That's your biggest risk right there. But also, all of the patrons coming to your home for the garage sale, yard sale, they're going to be touching all your items. There's another risk. We don't know what they could have, whether they have a cold or they have COVID. We don't know. These are the risks that we are currently upon us right now. The second part of that question is, could it affect opening? If there were a lot of garage sales right now and people were not being mindful of social distancing, limiting the number of people on their property, there is an increased risk for COVID transmission. Of course there would be. And that, of course, additional cases, additional burden on our hospital could definitely hurt our chances for continued phased openings of our county.
There was a question about summer camps. At what point will summer camps like YMCA Camp Jericho be opening?
I do know that the majority of our summer camp, we have 6 summer camps in Clinton County for 2020. They are currently evaluating the ability for them to open. Obviously, with COVID-19, the entire country is a little bit on edge, to say the least. So there are parents that are considering not sending their children to children's camps, which obviously hurt the attendance of these. So these children's camps right now are evaluating not only future guidance coming from the state, but also if they want to have enough children? Will they have enough attendance to make it worthwhile for them to have a children's camp in 2020? So right now, they're currently evaluating that. There's more to come on that. And as Mark Henry indicated, we wait for the state on a lot of the guidance moving forward. This guidance coming out to all of us, Health Department, Legislature, CVPH, comes out on a daily basis. Things change daily. I encourage everybody in the public to pay attention and research the state websites for COVID-19 because things are changing daily. This is all new, and we're trying to keep up with it right now. So.
Other questions just in regards to entity opening. Do we know when doctors' offices, eye doctors, places like that will be opening for routine exams?
So there is no legal. There's no legal requirement that doctors' offices be closed at this point. So it's really, you need to speak with your individual office. Now, I'm talking about ophthalmology offices. I do not know where optometrists fit in that, so I'm making that separation. But if you're talking about physician offices like an ophthalmologist, it's up to the individual office how they are constructing their workflows, how they are scheduling annual exams, etc. But doctors' offices are allowed to be open and to see patients, and they're all trying to figure out how to do so in as safe a way as possible. I know that it is not uncommon in pre-COVID days in a doctor's office or an optometrist's office to have 10 or 15 people sitting in a small waiting room. That's not going to be okay, so offices are all trying to figure out how do we do that. And I would encourage people to speak with their individual physician offices to get those answers.
Thank you. One of the other questions was there any further clarification on whether early intervention was part of phase 2 or considered phase 4 as education?
Early intervention services are, early intervention services are being provided in an adjusted way just like other school services, and in this county we are being as prudent as possible to protect families and providers in terms of the face-to-face visits. So the guidance on that is going to be evolving just like all other guidance. At this time, we're going to continue to accept referrals just like we have been, but the manner in which services are delivered is going to be dependent on how safe it is for in-person services to be provided. Any other questions before I unplug again?
I think that is all. Thank you very much. One of the other questions that we received, lots of opening related questions, but there was kind of an overall, when are things that were considered non-essential going to open up?
The phases basically cover the non-essential services. Essential services, while they may have been reduced due to trying to keep density low, essential services obviously have been open from the start. The phases are for the non-essential services. So we'll have phase 1, which we're in right now, which opens up construction and manufacturing, agriculture, forestry. You'll notice that those are industries that aren't necessarily dense. They have a lot of room. Density is a big problem. Phase 2, you'll notice, is when other non-essential businesses start opening. Those are going to be administrative support, as we talked today, professionals, hair salons, barbershops. Now we're getting closer spaces, smaller areas, maybe more people in those areas. Phase 3 addresses other non-essential businesses that are even more crowded. And then phase 4 addresses such things as schools, libraries, those type of sporting activities. So the phases are almost, you can look at as you go along, the businesses that are affected by the phases are more dense, have more people in a smaller area.
Thank you very much. We did have another question in regards to yard sales. Is there a chance yard sales could be allowed later in the summer?
With regard to garage sales being allowed later in the summer, I would definitely encourage that. We are doing very well right now. We're in phase 1 right now. The governor just changed one of his executive orders regarding social gatherings, mass gatherings. Previously, all gatherings were to be canceled, postponed, what have you. Now he's looking at 10 people or less, as I recall. Thus, I would say later in summer is better, gives you an opportunity to buy some time to allow you to have that sale. However, when you do have that sale, the first thing I'm going to say to you, I put the work and the plan in your hands. Those of you who want to have lawn or garage sales, make your own plan. Think safe, make your own plan. A couple of things you'll want to, even in July, August, early September, you'll want to minimize the number of people at your garage sale. Put that right on your sign. No more than 10 people, okay? Again, later in the summer. Ask patrons to wear a mask. It's your property. Ask them kindly on your sign, garage sale, lawn sale, please wear a mask. Ask them to wear a mask if they're going to be coming onto your property, especially if they're coming into your garage. And then have some hand sanitizer on hand, okay, at a couple of locations so people could use that, thus improving the ability for people to be abiding by the general regulations, the general requirements for COVID-19 to be safe, okay? When they're on your property, ask them, generally keep distant. Don't be all crowding together looking over one new dresser or something like that. Those are just some of the ideas that you can have within 10 minutes to put them down on a piece of paper and make a general plan for how you want to have your sale. Spread it out on your lawn, in your garage. Make it work for you. Thank you.
One other comment we received, hasn't the CDC said that risk is very low from touching surfaces, excuse me?
The CDC has said that the prime mode of transmission of this is through respiratory droplets. They are not saying it's impossible from surfaces by any stretch. In the world of microbiology, there are very few things that are impossible, but it's much less likely. And so, you know, what I try to tell people is, people like to revert to cleaning surfaces. It's kind of, it makes you feel good. It's like you feel when you clean your house. You're cleaning something, it makes you feel good. But the most important thing people can do is social distancing and masks when you can't. And it's interesting, we talked about this a lot last week, and there were comments about masking. You don't know that it works. Actually, we do know very well that it works. There are theoretical models that it works, but I can tell you from local experience. So I am well aware that in a number of our medical facilities in this community, there have been individuals who work at those facilities who have been diagnosed with COVID, because we're a reflection of the community, and they've been diagnosed with COVID. And in many cases, those individuals have been at work or presumed to have been at work while sick. We are not aware of transmission that has occurred at work, except when those individuals were not wearing masks. In other words, if the sick individual is wearing a mask, that is protecting other people, and that's why we wear them. We also know that masks, and probably even cloth masks, do have some element of protection for individuals. So in a webinar from New York State DOH just yesterday, they were talking about how much COVID was in New York City from their antibody tests. So if you recall, maybe 3 weeks ago, New York State went across the state and did antibody testing to see what percent of people had antibodies. In New York City in general, 20% of people had antibodies. 20% over the period of time got sick with COVID. That number in healthcare workers was only 12%. So the people at highest risk had the lowest infection. What does that tell us about the effectiveness of protective equipment? And while I would never tell a healthcare worker to go in a high-risk environment with a cloth mask, it does offer some protection. So it has some protection for you, and we know for a fact it really protects others from you if you're ill. So if it's easy to revert to, I got my Lysol, I can clean my shopping bags. That's not going to have nearly the impact of wearing a mask. So get off my soapbox now. So,
Thank you very much, and I believe that was our last question.
Thank you to today's speakers, and thank you for your questions. I hope that we responded to them adequately. I wanted to remind people that we do this weekly. We now do it on Wednesdays, so we will see you again next week at the same time. Thank you.